Hello everybody, Dr. Rick Mabanta. I had a patient come in this morning, and it was kind of an interesting, I was a little surprised to see her because when I saw her last week she said she was going to go away, and she showed up this morning. So I said, what happened? You were going to go to Vermont over the weekend, and she said, well, I couldn't go because my niece and my brother-in-law were sick. My brother-in-law, her father, came down with a very severe fever and severe headache, and it turned out that he was diagnosed with meningitis. And immediately I think of it from a chiropractic reference. And also her niece, she had a condition in which she had an exacerbation of her Lyme disease. Again, what came to my mind was how chiropractic care affects those two conditions. Both of those conditions can be affected and improved with the use of chiropractic care, and let me explain how. Both of those are immunological related conditions. So with the meningitis, for example, if you are having a viral, it's usually viral, bacteria is a lot more dangerous, but with a viral meningitis, your immune system gets suppressed and allows a virus to proliferate or grow in your cerebral spinal fluid, your brain. And so if you can improve your natural immune system, your natural defense mechanisms, you can reduce the occurrence of that particular virus or that growth of that virus. So it's an immune condition. Interestingly enough, with her niece, also, the Lyme disease is a microorganism that gets infiltrated into the blood, and she has flare-ups from time to time. She already had the acute treatment with antibiotics, but she still has flare-ups, which means that organism has a tendency to proliferate or grow. Again, an immunological response. When her immune system is suppressed, the organism can grow. So in both of those cases, I said to the patient, you should tell your family they should get checked chiropractically. The way that chiropractic affects that is by adjusting the spine, and we know this through latest research, that when you adjust and correct and normalize the function of the spine in its movement, its rigidity, and its reflexibility, which is the three things the spine should do, if you can improve that function through spinal adjustments, you can improve the function of the brain, the prefrontal cortex. You control the brain. It affects the balance of the autonomic nervous system, sympathetic versus parasympathetic. The sympathetic is your fight or flight mode, or fear or stress mode, and your parasympathetic is your healing, regeneration, immune enhancing mode. Just the spine, affect the brain, shift from sympathetic to parasympathetic, immune system comes up, and you fight off microorganisms, viruses, spirochetes in the case of a Lyme disease, and symptoms reduce. So she couldn't go. She came in for her chiropractic care because she's been under care for a while. She uses it regularly for spinal health and maintenance, for wellness maintenance, but her family still is under care. And the reason why I stress the story is because there's a lot of conditions like that out there that people are suffering from, taking perhaps medications which maybe have harmful side effects, and you can avoid those by utilizing a natural method like chiropractic. So I encourage you, whenever you're going through any kind of health crisis, to get your spine checked, improve your brain function, improve your immune system, and stay healthy. Thanks. I'll talk to you later.